Okay, start.
Okay, so you're talking to Mrs. Fatma, who is the mother of Ahmed. Ahmed is a 4 years old boy whose mother says he is not growing like his sister.
Ahmad is 4 years old boy. Mother says he's not growing like his sister.
Yes. So you want 4 minutes to prepare? I think it's 4 minutes.
Yeah,
Then how
we
many
will
minutes?
take the 4 minutes, but I will keep the timer to just to know how long I will take to prepare. But just 1 minute.
Okay.
Fatma, mother of Ahmad, 4 years old boy. Mother says he's not growing like sister. This is the only.
Yes.
Which
Yes.
task you want to do?
Okay, so you will examine the fine motor. Sorry, I
Fine.
forgot. Fine motor and vision. Yeah.
Okay. Okay, no problem. Good morning.
Morning.
This is Dr. Noor, one of the children's doctor in this hospital. Am I with Mrs. Fatma, the mother of Ahmad?
Yes, doctor, you're talking to Miss Fatma.
Okay, thank you for coming here and nice to meet you.
You're welcome. You're welcome, doctor.
Okay, Mrs. Fatma, how can I call you?
You can call me Fatma, no problem.
Okay, thank you so much. So today I am here to discuss about Ahmad's condition, about his
Yes.
development. Is it okay for you if I take some notes?
Yes, no problem. No problem. Go ahead.
Okay, so tell me, if, Fatma, what's your concern about Ahmad?
Ever since I gave birth to them, I just feel that whenever the way the sister is growing is not growing the same. He is slow, and when the sister started working, it was early, but his own was delayed. I don't know what caused it. I'm just very, very worried and concerned.
Okay, from when you are noticing this, that he is slow and delayed?
Well, I noticed actually it became obvious at 18 months when he didn't walk. And I just don't know why, because the sister was walking before 18 months, but his own is extremely delayed, like 18 months and not walking. So I was worried. But then, like when it was 20, 21 months, it walked. So I felt okay, fine. That maybe I was just worried. So I didn't go to the doctor. But every other thing is also delayed too. Like if I compare him with his sister, then it is very, very much delayed. So I just came to the GP.
Okay, you did a good job, so that we can evaluate him.
Thank you.
So from the age of 18 months, you felt that he is slow. So anything
Yes.
done till now for investigations or any team of doctors you're following?
No, no, no investigations. When he was born, yes, we were following a cardiologist, and then they just gave us like a 6 month follow up just to know what is wrong. But they said it's fine because it's not on any drugs.
Okay, so cardiologist, you mean the heart doctor?
Yes, yes, the heart doctor is following the
He
heart
had any
doctor.
problem in the heart?
Yes, when he was born, they said he had a small opening, and then they would just follow up for the small opening.
Okay. Did they tell you anything? What is the cause for the small opening? I mean to say, he is known to have any condition or illness?
No, no, no illness, no, just a small opening.
Okay, just a small normal opening. But now it's closed?
Yes.
Okay.
We have a follow up in 3 months, but they said it is very small, so he doesn't need any medication, just for follow up.
Okay. And also he's fine. He has no chest pain and no other problems.
Yes, no chest pain. Is doing very fine, but I just feel he's delayed developmentally.
Okay. Any medication? He's on any medications?
No, he's not on any medication.
Okay, great. Do you see anything like he acquired any skills, and did he lose any skills?
No, no, no. He didn't, I don't think he lost any skills, but it's just not acquiring the skills.
Anything you notice, any problems in his vision?
Well, yes, he's using glasses, so I guess that would count.
He wears glasses. But is he
Yes, yes.
reading good with the glasses?
Yes, he's reading good with the glasses.
Okay.
He's been using the glasses since he was 12 months.
Okay. Does he has any problem with the hearing?
No, not that I know of. When I call him, he answers me, so no.
Okay. Any behavior, any abnormal behaviors or anything you see in Ahmad?
Abnormal behavior is like what?
Maybe he is hyperactive, or you see he is not playing with others, not interacting, anything like this?
No,
No.
no abnormal behavior. He's doing fine here.
Okay. Weakness, any weakness in you think that any part of his body is weak?
No, I don't think so. Just that every other thing is just slow. Slow to use to
So I will
eat,
ask
slow
you
to do everything.
few questions about his development.
Okay.
So can he run
Okay.
upstairs? Can he go upstairs and downstairs like an adult?
No. He goes upstairs, which is 2 feet, and then it comes downstairs, which is 2 feet also.
Okay, goes upstairs and downstairs 2 feet. Does he
Yeah.
is he able to run?
No. Yes, he can run, but he runs stiffly.
Stiffly. Okay.
Yeah.
Is he able to walk steadily?
Yes. Now he's walking steadily.
Okay. About speech, can he sing a song?
No, we cannot sing a song.
If I ask him some question, how many sentences he will answer usually? Like what are you doing? Like this, if I ask.
6 minutes.
Okay.
He will say 4 words.
4 words.
3 words rather. 3 words.
3 word sentences. Okay.
Yeah.
You know how many words he is speaking? How many words he can speak?
No, sometimes he just talks very fast. I still don't really understand him, but when he says the 3 words, then I understand him clearly.
Okay, but you don't know how many words he knows, like 20 words, 50 words.
No, I don't know.
Okay, no problem. If you tell him to take this horse and keep it on the table, he can follow your command?
If I just tell him to bring something, yes, he does. But if I say, bring this and put this, no, he doesn't.
Okay, fine. I want to ask, how is he playing with the friends? Sharing.
What did you say?
Is he sharing toys
No.
with others?
No, he's not sharing toys.
What
No.
kind of
No,
play
not
he
at all.
plays? You have seen him, according to your observation, how he plays?
He plays alone.
Alone.
And then he does peekaboo and then bye. So just plays alone.
Alone. Okay. Toilet, can you tell me, is he dry by day?
No, not yet.
Not yet. He's still in nappies. Okay.
Yes, it's still in
Can you
nappies.
tell me about your pregnancy?
Well, my pregnancy, I delivered them at 31 weeks. It was emergency CS, and then it was preterm labor due to fetal distress.
Okay, preterm labor due to distress. So what problems you noticed immediately after birth in the child?
Well, when I delivered them, they said he was very small. His birth weight was 1.8 kg. So then they admitted him. His sister was fine. She was with me, but he was in the NICU for like 13 days.
The sister and he, they are twins?
Yes, they are twins.
They both born at 31 weeks?
Yes.
The sister's weight was good?
Yes. Our weight was 2.3 kg.
Okay.
And she was very active, was sucking, so she was not admitted.
Okay, it was a normal delivery.
No, it was a CS, emergency CS.
Okay, did they tell you what is the cause for the CS?
They said there was fetal distress when they did this something called CTG.
Okay, so any fever, any jaundice for your baby after birth?
No. He was discharged at 13 days and he was sucking a bit. So his weight was 1.9. So they said he's good. So he was discharged with me.
For 13 days, he was in the intensive baby care unit.
Yes, he was in a special care baby unit.
Okay, he was attached to any breathing machine.
Yes, they gave him oxygen for a few days, and then they monitored him because he wasn't really sucking well. They said they wanted to check for infection, but then they said he was fine, so he was discharged.
Okay, so past, can you tell, apart from this admission for 13 days, any other admissions for him till now?
No other admission. He was
Any
been doing
fever,
very fine.
any bug infection for him, any trauma for him before?
No, none.
No bug.
No, 10 minutes finished.
Okay.
So, can you summarize your case for me?
Yeah, today I took history from Fatma, the mother of Ahmad. Ahmad is a 4 years old boy. He according to the mother, he is slow compared to his sister. They both are twins. And on my questions, she said that he has no regression. He's slow from she observed that he's slow from the age of 18 months. He walked late, and in gross motor he can go upstairs and downstairs like a child manner, and he can walk steadily and run stiffly. And in speech, he cannot sing a song. He can just say few 3-word sentences, and he can just follow one order command. And socially, he's still dry by day. He's still in nappies. He's not dry by day, and he does not share toys and plays alone. And there is a stormy neonatal period. He was born at 31 weeks as preterm birth. His birth weight was 1.8 kg, and was admitted in the neonatal ICU with oxygen for 13 days. The sister with him is a twin sister. She was fine, well sucking, and he was observed till he was able to suck and was discharged. No, in the past medical history, no history of any other admissions, no history of bug infection or any trauma. I could not take family history and social history due to the time factor, but I will consider to explore more about it.
Okay. Excellent. You also did not take vaccination history and nutrition history also.
Yeah, but they say.
For every other thing you could.
But they say the time will not
because
be.
Well, according to the doctor, he said for the history taken and the development that the time is enough. I don't know how.
See, there is. I could not cover family history and social history. Next time,
Yes.
let me see. I will give to you. Try to be. Maybe I wasted time here in what done so far. The teams, I wasted a bit time here. So we should.
Yeah. During your questioning, you're supposed to just ask like 2, maybe top 3 questions in each domains. In the gross, the hearing, and the social language, you cannot cover all.
Yeah, I asked about 3 questions here. I asked about going upstairs, downstairs, running, and walking steadily. In speech, I ordered songs, sentences, then order commands. I don't know how to manage.
I think next time just make it 2 so that you will have enough time.
Let's see.
To take it out because the social history. That's what the doctor said. Okay. So
I will go for my
now we finished.
Okay, I will go for my examination. Okay.
Okay.
Okay. So.
Okay. Wait. I will reset the time. Okay. Start.
Okay. So after washing my hands, I'll just.
Excellent.
Ahmad, 8 minutes. Yeah. After washing my hands, I'll just observe what Ahmad is doing in the room.
Mhm.
What is Ahmad doing in the room?
Ahmed is just is sitting, is playing with his mom, and then clapping his hands and happy.
Okay, so I want to see whether he's well looking, not in distress.
He's well looking, not in distress,
I want
no unusual features.
Okay, I want to check his weight, height, and head circumference and plot on the appropriate growth chart for age and sex.
He has appropriate weight for his age.
Okay, I will look if he's wearing glasses or any hearing aids or any attached devices to him, and also anything in the surroundings he has brought.
Nothing in the surrounding, no hearing aids. He's putting on glasses.
Okay, I will first start with communicating with him to see how is he communicating. Ahmad, I will call him.
Yes, he's answering you.
Okay, great. I want to check
It
his
turns to
vision.
you.
Yeah. Okay, I want to check his vision. I will tell Ahmad, let's play. I will show
Mhm.
him a colored cube and ask him to pick me the same colored cube. Can he do for me?
Yes, he's speaking the same color.
Okay. Ahmad, let's play with the cubes. Since I took the cubes, I'll start playing with cubes. I will ask Ahmad to, I will
Mhm.
show him to build a tower and ask him to build the tower. How many tower he can build?
Yeah, he's building 5 and 6. 5 and 6.
5 and 6. Okay. I will
Yeah.
just ask him, I will show him a bridge to make a bridge. Can he make?
No, he cannot make a
I will
bridge.
show him to make a train.
He cannot make a train.
Okay. Then I will tell Ahmad, let's play. I will remove the cubes. Then I will say, Ahmad, let's play
Okay.
with the paper and the pen. So I will take crayons.
Mhm.
Then I will
Mhm.
take a paper and see. I will give him a crayon and see in which hand he is holding and how is he holding.
He's holding in the left hand and he's using a digital grip.
Okay, left hand and digital grip he's holding. Okay, then
Yeah.
I will show him to draw a circle. I will draw a circle and show him to draw a circle.
No, he cannot draw a circle.
Okay, I'll draw a horizontal line for him and ask him to draw if he can.
Yes, he can draw on the horizontal line.
Okay, I'll say Ahmad is a good boy. I will clap. Then I will give him the scissor scissor and see how is
Mhm.
he holding the scissor.
He's using the two hands to hold the scissors.
Okay, I will show him. See, Ahmad, can you cut like this? Is he able to cut?
No, he's not able to cut.
Okay, then I think beads will be difficult for him, but just I will give a try. I will show him a large bead and take a large thread and ask him to put like this. Is he taking a bead in his hand and trying?
Yes, he's taking the beads, he's trying, but he cannot put it in.
Okay, Ahmad, let's read something from the book and I will ask him to turn pages. How many pages he will turn?
He's turning a single page, page by page.
Single page. Okay. There is a
Mhm.
board. Come, let's play in the board. I will tell him. I will give him circle, square, triangle, star like this. Can he put the shapes? What shapes he can put?
He's putting two shapes, the star and the triangle. Two
Star
shapes only.
shapes. Okay. I will say Ahmad, I will clap and say Ahmad, it was very nice to play with you. And then I will present to the examiner. Today
Okay.
I examined Ahmad, 4 years old boy, for fine motor examination. On my examination, he is well looking, not in distress,
Mhm.
no dysmorphic, no unusual features, and he's wearing glasses.
Mhm.
And he was playing with his mom before I start. He's communicating and he's hearing well when I started. Then
Mhm.
he is able to pick up the cube of the same color on asking, and his
Mhm.
he today he was able to demonstrate building a tower of 5 cubes, but was not able to do a train and a bridge. And today he was able to
Okay.
demonstrate a digital grasp in the left hand with
Mm,
drawing just a horizontal line, and
mm,
was not able to draw the circle today. And scissor he is
mhm,
holding with two hands and unable to cut. Beads he
mm,
just tried, but he was not able to. Book he's able to turn
mm.
single pages, and in the board he can just put two normal shapes, I mean two simple shapes.
Okay.
So with these findings, Ahmad, and according as per my history and my examination, Ahmad looks to have global
Mhm.
developmental delay in all the domains of development, and I will give him a
Excellent.
age of mm, I will give him an age of 1.18 months to 2 years in fine motor
Okay.
developmental assessment, or I can give him
Okay.
21 to 24 months. Sorry, 21 to 24 months.
Okay. Okay.
Because I think less than
Okay.
2 years, we have to give 3 months age.
Yes, 2 to 4 months. 2 to 4 months. Yeah. Is it 2 to 4 months or 2 to 3 months? 2 to 3 months. Yes.
No, if it is less than
One. Okay.
2 years age, if you are
Mm-hmm.
telling less than 2 years, your range you will give is from for 3 months, like 21 to
Yeah.
24 months I will give. But if he was demonstrating skills up to 3 to 3.5 years, I will give 3 to 3.5 years, like this.
Yeah.
Uh,
Yeah.
I hope
You're
you
right.
got my point. If less than 2 years, give
Yes.
three
Yes.
months difference. If more than two
Okay.
years, give 6 months difference.
Yeah.
Okay.
Actually, in Mrcpch, they said if less than 2 years, you give between 2 to 3 months,
Yeah, it's
and
okay.
if more than 2 years, you give
Six
four to
months.
6 months. So it depends. Yeah.
Yeah,
So
yeah.
you're still.
Better 3 months and 6 months because of the range. You will not get confused.
Yeah.
6 months is easily to tell. 3 to 3.5 years, 4 to 4.5 years, like this. And for 3 months, you can say
Okay.
18 to 21 months, or 21 to 24 months, like this.
Okay. So your assessment was excellently done. The
Mm.
age range is actually 18 months to 2 years, like you said, and this is global developmental delay. So okay, you stopped at 6 minutes 38 seconds. So I will start. So how would you manage this child?
Yes, this child is, he needs a multidisciplinary team management. He was born as a preterm, and also he had a hole in the heart. He is following up with cardiologist, and he may need the complete developmental team coordinated by community pediatrician in the form of physiotherapist, occupational therapist, and speech and language therapist. And maybe he has some problem with the vision, so I want to involve the ophthalmologist as well, because he's a preterm. And
Okay.
related to his preterm, I am not sure if he has any spasticity or any features of cerebral palsy, so I would also
Mhm.
consider involving neurologist for him.
Okay. Okay. You have just 24 seconds left. So, uh, very, very good. And then stepwise, it was good. In the management,
Hmm.
apart from saying you're supposed to say you would like to do a neurological assessment
Oh, in
because
order,
of because yes, in
I
order to
did not
complete
tell
my
in order
exam,
to
you need,
complete. Yes, yes, good point. Tell me what I should tell. Neurological, yeah.
and yes, I would like to do a neurological examination. And like you said, management will involve the multidisciplinary team. Like you said, also, it is going to be headed by the community pediatrician, the physiotherapist, the occupational, and then also social, because you did not take the social history. The child will need social support, the mother will need social support. And then because of the age, the
Hmm.
child would need what is called
Cool.
educational and health care plan.
Yeah, EHCP, Educational Healthcare Plan.
EHCP, yes, this is very important. Yes.
Special Educational
So,
Coordinator also we can add here. They will coordinate with her for
mhm,
this educational healthcare plan.
yes.
Okay.
But the most important thing, because the mother, she has twins and she has no support, so she's going to need social support. For every other thing, it took. It was okay.
What about
Very
he
good.
has any features of CP or no?
No features of CP, just delayed global developmental delay.
Okay, because the cause, if he
Apart
asks
from that, no other.
if he asks what is the cause in this child, it will be like prematurity, prematurely born.
Yes.
Maybe the eyes are affected,
Mhm.
vision, because of the retinopathy of prematurity. This I can tell.
Yes, excellent.
Okay.
You could during your history, you did not ask about any investigation, any cranial ultrasound done because of the age.
Yeah, but I asked in the beginning what
Okay.
investigations done so far, but I should have asked in past medical history, right?
Yes. You should have asked during when you were taking the perinatal history, because if you ask any investigation done, you're talking about now,
Mm-hmm.
not when the child was born.
Yeah, I should ask
Mm.
about cranial ultrasound here. Yes, you're right.
Yes.
But the thing is, I don't know how to manage the time really. Let's see.
Yes.
Let's try, inshallah. If we practice several times, inshallah, we will manage. Inshallah.
Inshallah.
So
Look,
I will give you now. Okay.
it was very well done. Okay. So you give me mine. Because it is a closed question,
Okay.
so she's going
Complain
to talk
question.
more.
Okay.
Yes. So you quickly go to the domains, the other domains, and then the pregnancy and the perinatal history, the family history, and the social history. So if you still have time, then you can go back and follow up.
Okay, inshallah. Yeah. Let's see how it will, how you will manage. If there is any problems, we can try to cover up in next another 2 cases, inshallah. No problem. Okay.
Inshallah. Okay.
Umar is
Hmm?
3 years old. Umar is 3 years old child. Mother has concerns about his development.
Okay.
Please take focused history and do your assessment in speech and language and social.
Wow, okay.
Okay. Speech and language and social. Okay.
Okay.
Because speech and language and social, they are usually giving together. They are not giving separately. That's why let's practice like this.
Yes.
Social,
They are
they are.
calling it communication.
Yeah. So you prepare your template. Let's do like exam only. Let's take 4 minutes to prepare ourselves so that we can manage.
Mhm.
Okay. I will also write my template,
Okay.
see what you will do, what you will not do, to give your feedback, and then we will start. For I will keep time now, from now 3.5 minutes, because half minute for this command. Okay.
Okay.
6 minutes. 6 minutes, then four
Mhm.
minutes. I will alert you at 6 minutes. Okay. Then I will
Okay.
continue 4 minutes. Okay, you can start now.
Hello, good morning.
Good morning.
I am Rahma, one of the pediatric specialists. I believe you are mother of Omar.
Yes, doctor, this is me.
Nice to meet you. How may I address you, please?
Call me Sarah. My name is Sarah. Call me Sarah.
Okay, excellent, Sarah. Nice to meet you. Thank you for coming here today, for Sarah. So I've been asked to take some information from you regarding Umar. Can you tell me more about your concerns for Umar, please?
Yes, doctor. I see Umar is slow compared to his compared to other children, and also his
Okay.
brothers and sisters. I feel he's slow. From the beginning, I feel now he's 3 years old. I am not
Mhm.
happy with him. That's why I came to the GP and he referred me to you.
Okay, I'm sorry to hear that. Can you tell me in what exact areas do you think he is slow, if
I
I may
think
ask?
I think he's slow in everything, doctor. In walking, in talking, and eating, everything. I feel he's slow.
Okay, can you tell me when exactly you noticed that he's slow?
Yes, I noticed when he did not walk. Uh, Even when he was 2 years old, he was not walking that well. He had a tendency to fall. So
Oh,
I got a bit worried. Now he's 3 years. Now he's able to walk properly.
okay. Okay, excellent. So, when exactly did he start walking?
Hmm? Yes.
At what age did he start walking?
Yeah, at now I can say at 2.5 years, 2.5 years age.
Okay. Was he using his bottom to shuffle before he walks, or he didn't? He wasn't a bottom shuffler.
No, no, no. There's no bottom shuffling in our house. Nobody did bottom shuffling.
Oh, okay, okay, no problem. So, apart from him not walking, is there any other thing you notice about him that you would like me to know?
As I told you, generally slow doctor. He just speaks maybe 6 words. He just speaks 6 words
Okay.
only.
Okay. 6 word. Okay, no problem. So tell me, has he been admitted before to the hospital? Any previous history of hospital admission?
Yes, yes. He was admitted once when he was 2 years old. Uh,
Okay.
he had this fits. He had fits, one episode of fits, and he was admitted at that time. Yes.
Okay. And how many days did he spend in the hospital, and which ward was he admitted in?
He was admitted for one night in the intensive care unit. The doctors told just to observe him. They are admitting there. Then next day he was in a normal ward.
Okay. Do you remember the investigations that was done for him, and
Yeah.
what did they say was wrong with him?
Yes, doctor. Some brain scan was done, but I
Mm-hmm.
don't know what exactly the scan said. Brain scan was done for him, and some also they say some electrical response in the brain was done for him. I don't know what it is.
Okay. Was he placed on any drugs?
Yes, yes, he is taking medications.
Do you know the name of the medication he's taking?
Yeah, I don't remember. I think it's Dipakine.
Okay, no problem. It's okay. Okay. So, apart from the packing, is he on any other
No,
medications?
no, no, no medications.
Is he on follow up with the doctors, the
Yeah,
brain
but he's
doctors, or any
following.
other doctors?
He's following only with the brain doctor.
Okay, excellent. So, apart from that, apart from this, when he was 3 years old, has he had any other fits?
No, doctor. It is well controlled with the medications.
Okay, excellent. Any history of trauma or surgery?
No history of trauma. No history of surgery.
Okay, excellent. So, you said he's walked at 2 years. Can you tell me how does he go up and down the stairs? How does he climb the stairs?
Yes, he climbs with both climbs with both the feet, both up and down.
Okay, okay. And how does he run?
Running is difficult for him, doctor. He has a tendency to fall.
Okay, no problem. Okay. Can you tell me does he play with cubes?
Yes, he plays with cubes.
So does he make a tower, and like how many cubes of towers does he build?
Uh, four and four he builds by himself, and after showing he can go up to six.
Okay, excellent. So does he know how to scribble? Does he scribble very well, or what does he do when you give him a pen or
Yeah,
a color?
if I give him a pen, he will just scribble. But if I show him to draw a line, he can draw.
Okay, horizontal line or a vertical line?
Both he can draw.
Okay, excellent. Okay, can you tell me more about your pregnant while you were pregnant with Umar? Were you sick at any time?
6 minutes finish, 4 minutes left. No,
Okay.
doctor, no sickness.
Okay, and then after delivery?
Yes, it was a normal delivery at mm, 38 weeks, they said, and he was 3 kg.
Okay.
He was crying immediately after birth, no complaints.
Okay, so you didn't need any extra care? And at what time were you discharged from the hospital?
Because he was crying, they said no need for anything. They did some examination for the baby. They said he is fine and they discharged.
Okay, excellent. Did you do any test, any newborn screening test was done?
Yes, the hearing test is done for him at that time and they said normal.
Okay, what about the blood tests?
Blood tests also they did and it's normal. No problem.
Okay. So tell me, how has this condition impacted you as a family?
Mm, yes, actually, I am worried about him because I was thinking that he will be fine by himself. Now he's 3 years, he's just walking, not running. So I am worried actually. Yes, doctor.
I'm sorry about that. Do you have any other children apart from Umar?
Yes, I have 2 children. They are elder to
Oh,
Umar.
okay. What do you do and what does your husband do?
I am a teacher and my husband is a lawyer. And we are
Okay.
fine, doctor.
Are you related by blood?
No.
Okay. Can you tell me, has Umar completed all his jobs? Is he on any other does he receive any extra jobs?
No. He's completed his jobs. Yes.
Okay. And how is his feeding? How is his eating? Do you have any concern about his eating?
Uh, Feeding is your social history, right?
No, I'm taking no, not yet. Nutritional history.
You're taking nutrition. Yeah, yeah,
Yeah.
he's eating. He is eating okay. He doesn't like to feed by himself. I feed him.
Okay, excellent. So tell me, how do you have any extra support, or how do you take care of Omar and his other siblings?
Yes, my mother is there. She takes care of them in our absence. So no problem.
Mhm.
We don't have any problem with it.
Oh, okay, that's good. Okay. Do you have any complaint about his vision? Do you notice anything?
No, I don't have any. Yes, he is wearing glasses. With the glasses, he is fine. But at the moment, I don't have anything.
Is he following the eye doctor?
Only for glasses, yes. We are following with the eye doctor, yes.
Okay. So apart from the eye doctor and the brain doctor, no other follow-up. Does it react to any food or any drugs, any medication?
No, means you are asking for allergy?
Yes.
No.
Okay. Miss Sarah, I'm just going to sum up everything that you've told me so far. Okay.
Yeah, 22
Uh,
seconds left.
s- okay. So you're concerned about Omar. You said about his development. You said he's slow compared to others, his brothers, and then you feel that he's slow in everything. He walked at 2.5 years. He climbs with 2 feet and then comes down with 2 feet. He runs stiffly. He's using glasses and following up with
You're
ophthalmology.
wait. You're summarizing to examiner, right?
No,
Or
to the mother.
no. Now time finish. You summarize to the
Okay.
examiner. Okay. Just okay.
Okay. So I took history from Mrs. Sarah, who is mother of Omar, a 3 years old boy. She's concerned about his development and she feels he's slow as compared to his brother. He walked at the age of 2 years. He goes up and down the stairs with 2 feet. He runs stiffly. He's using glasses and is following with the ophthalmologist. He can build a tower of 4 to 6, and it writes both vertical and horizontal line. The pregnancy was uneventful, and then delivery also. However, at the age of 2 years old, he had fits and he was admitted for one day in. He spent one day in ICU and the rest in the ward. He did the brain scan and EEG and is currently on Dipakine, no other medications. He's also following up with the brain doctor, no history of trauma or surgery. He has completed his vaccination. His hearing test and newborn screening test was normal. Um, he has two elder siblings. The mother is a teacher and the father is a lawyer. They are no consanguinity. And yes, the mother is worried, so this has affected her. Um, it has impacted her socially and the family also.
Okay. So okay, now you can start. There is 32 seconds left in 2 minutes, no problem. Do your examination now.
So I'm going to wash my hands and then explain to the mother that I'm going to play with Omar. So does he have any unusual features?
No unusual features in the face. He's just wearing glasses.
Okay, okay. So does he look ill or is he in distress? Any
No,
flaring or tachypnea?
no, he's not in distress.
So apart from glasses, does he have any equipment in the surrounding?
No.
Okay, excellent. So I'm going to take all my toys that I need. I'm going to take the color, I'm going to take the book, and then yeah. So I'm going to take some toys that you can play with, maybe a car. So I'm going to call him. Omar, is he answering me?
Yes. No, no, no. He did not turn to you. You call Umar. He did not turn to you. He's playing in his car.
Okay, he's playing in his car. So I'm going to face him and say, Omar again. Is he looking at me? Is he making eye contact?
No, he did not look at you. He's playing in his car only.
Okay, so I'm going to hit my leg and say, ouch, ouch. Did he look at me? Did any facial?
He's continuously turning the wheel of the car.
Okay, so no facial contact. Okay, so I would like to ask because he's not. I'm going to ask the mother that if I take his car, is he going to cry? If I'm allowed.
Yeah, mother says, don't ever do this, doctor. We cannot sit in this room. He will cry like that.
Okay. So Homer is not responding to me, and then I would like to ask the mother some questions. Is it okay if I ask the mother some questions?
Yes, no problem.
Okay. So I would like to know, does he talk with you at home? Does he talk with you, or when you call him, does he answer you?
No, doctor, he doesn't answer. He is always playing in his own toy, sitting on us on the same chair.
Okay. So he doesn't talk at all. That means he has a delayed speech, or he's not talking at all.
He talks. He talks only 6 words. He
Okay,
speaks.
so does he repeat his words like he says toy, toy, toy?
Yes, sometimes he does it. Yes, sometimes for 6 hours he just repeats seven, seven, seven like this. Yes, he does like that.
Okay.
Yes.
So you said when he's does he have any other toys he plays with apart from the car he's playing with?
No, he likes this red car and the wheel of that. He keeps playing in that only.
Okay. So does he have any movement, any body movement he does repeatedly? Like maybe he's flapping his hands, or maybe he's just nodding
Yes,
his
you
head
can.
or shaking his head.
Yes, yes, he's flapping his hands. Yes.
Okay. So does he smile?
No, not no.
Okay, and you said if his toy is taking a throws tantrum, right?
Yes.
Okay. So if you tell him, Omar, bring this, does he answer you?
No, he will not bring.
Okay. Okay, so I think that's about all. Okay, so when he's talking to you, does he talk in monotones?
What do you mean by monotones? Can you tell me, doctor?
Like he just it's more like repetition, but he's using the same tone for everything.
Yes, he uses the same tone, but he can speak some few words like mama, baba. He can say red like this. Maybe if I count only 6 words.
Okay. So if he needs something, does it take your hand and take you there by pointing, or does it point?
No, he wants water. He takes my hands to the water. He doesn't point.
Oh, okay. So is it still in diapers? Is it dry by day?
And no, he's still in diapers.
Okay. So does he play alone or he plays with his friends?
Alone, always alone.
Okay. So it's, does he play peekaboo with you? Does he wave bye bye to you?
No, no.
Okay. So when he's eating, can he eat alone or you have to feed him? Does he know how to use the spoon alone? The
No,
the
no,
knife?
no,
The
no.
fork?
Only he can drink by the cup.
Okay.
Holding two hands, he can drink by the cup.
Okay. So can he undress? Can he remove his socks and his shoes by himself, or you have to do it for him?
Occasionally, he can do.
Okay.
Mm.
So I think that's how many seconds left?
No, but ask about this also. Speech also. Take the history from the mother. She told about words. Take other things like
Ah,
take the other things.
okay.
Like, ask the mother. Yeah.
Because of the age, it is practically nothing. And if he can it points to color, does it know colors?
No, he will not point to you, but he knows to tell red color only.
Okay, only one color. So he only knows one color. Okay.
Yeah.
That's it. Because no other thing. Does it sing?
Hmm? No,
Does it sing or does it sing
not,
any?
no, he will not sing.
Okay, I finished.
Okay, you can present your case, no problem.
How many minutes left?
1 minute left, 1 minute 26 seconds. You can present your case because you have to finish presentation in this 8 minutes. So present and then
Okay.
viva, yeah.
Okay, so I called Umar and it did not turn to me and it did not answer me. There was no eye contact. There was no facial contact also. So I asked the mother. He has rigid routine. He has repetitive body movement. He plays. He does solitary play. He has delayed speech, echolalia also, and he speaks in monotone. He doesn't smile, and if his routine is disturbed, it throws tantrum. For speech and language, he says only one sentence, one word sentence. He knows one color. He does not answer orders, and he's still in diapers. And he uses the cup. He uses the cup to drink water. He doesn't use the spoon. He's still being fed, and he occasionally takes off his shoes and socks. So putting all this together, I would put his speech and language and social between 18 months to 21 months. Let's timer.
Okay, no, this is 8 minutes. Yes, 8 minutes. So you said 18 months.
Yes, and also I think Omar is also on the autistic spectrum. Autistic spectrum. So I would like to do a checklist for autistic spectrum disorder, and then to ask some questions, to fill some questionnaires regarding his symptoms.
So how do you diagnose autistic spectrum disorder?
Uh, there is a checklist called checklist for autistic autistic test, and then there's also CAST, Children Autistic Spectrum Tests. And then you will be referred to the developmental specialist for full assessment.
Okay, you said CAST, and what else you said? Mrcpch?
Charts. Yes.
Chat and CAST. Okay. Then you will refer to developmental assessment. Do you know how what about how they do this assessment? Do you know?
No, I don't know.
Okay. Then autistic spectrum diagnosis finished. So how do you want to manage this child?
Oh, you mean, do I know? Like, okay, fine. The child will be assessed in the social, communication, and behavior, and the behavioral stages. And then the questionnaires will be given to will be filled by either the mother. If he has started at preschool, then it will also be filled by his teacher or anybody he spends time with.
Okay, he is assessed in social interaction,
Okay.
social communication, and in repetitive
And
behaviors. And in
yeah.
behaviors. Three domains: social interaction, social communication, and repetitive behaviors. He will be assessed in these three domains in different settings.
Yeah.
Okay, he will be assessed in three domains in different settings. Okay, management of this child, what do you do?
Management, the management will start with full neurodevelopmental assessment or examination, and then is going to need develop multidisciplinary management, which is going to be headed by the community consultant, community pediatrician, developmental specialist. Is also going to need speech and language therapist, occupational therapist and physiotherapist, educational healthcare plan, social worker. And then what else? Okay, I think that's all. And then the neurologist, because it's also following the neurologist for fits, which I'm suspecting could be should I have asked about to rule out infantile spasm?
Yes,
because you said
yes, you did not ask. Yes. Okay, if finished, I will give the feedback. Okay, they may ask you some questions.
Okay.
Like if I ask you, you said speech and language therapist. How the speech and language therapist will help this child?
They could either augment the speech or give an alternate speech. So for augment, they will try to talk more with him. For alternative, they can use maybe by what is it?
Sign languages. Augmentative and alternative they will do.
Yeah.
For alternative, they will use sign language. Sign language. They will teach the children sign languages.
Oh, okay.
Okay. You know the example of sign languages? Mrcpch.
American Sign Languages.
Yeah, Mrcpch sign language is there. Okay.
But Mrcpch, because the child has to write and the child is still 3 years old.
I don't know. I'm just telling you, they may ask you in general, what are the sign languages? Or they can touch screen also, touch screen. Mrcpch, I don't think
yes. They give pictures?
No. They will,
because for this child, they can give pictures.
Yeah.
And then he can point on what he wants.
Yeah. I mean, there is something called touch screen Mrcpch language. Maybe I think there is no writing there. They have to, I don't know what is it. We will check, no problem. This is the alternative they treat. But for the augmentation, they give some exercises to the oromotor. They sit and spend time with them teaching the speech, and they give some oromotor exercises, and also they tell the parents to teach them. Okay, like this. Okay, so I will give you your feedback from the beginning. So you started with the history of present illness. You have been told that he was observed slow from the beginning, but the mother started worrying from the age of 2 years. Okay. When he did not walk in 2 years. This was the thing. Then your past medical history exploration was very good, But I don't know, from the slow, after slow you went directly to past medical history. We can do like that. I don't know this. You explored first past medical history, then you came to the gross motor and fine motor. Maybe we can do, I'm not sure. But your exploration of past medical history was very good, about the fits, about the brain. But you did not ask any time in your conversation, did the doctor told you that he has any condition?
I
Uh,
asked, I said, was there any diagnosis? You said,
you
no, I
tell
don't know.
diagnosis, did you ask? I'm not sure really.
Yes.
Okay, no
I
problem.
said, was any diagnosis given?
The diagnosis, I think better ask like condition or illness or something. I'm not sure. Is the diagnosis is not jargon?
Uh, I don't think so. It's an English word.
Yeah, it's an English, but I am not sure. Did anyone tell you that we can use this word diagnosis?
I
Okay,
don't know. I
anyway,
don't know. I'm just assuming.
ask condition, illness. It's okay, better, huh? Okay.
Okay.
So if you have asked, maybe I missed or something. I'm not sure. My in my mind was, you would have explored more about the fits. What is the reason for his epilepsy? I mean, what is the reason for this
Mhm.
fits? What reason was given to you for? Even she did not answer for a diagnose. You can ask in a different way, what is the reason, what is the reason for this fits, was it told to you like this? Maybe only once he got, maybe just electrolyte imbalance, or but he was done EEG and following Dipakine, right? So most probably there is something
Mhm.
in the brain.
Yeah.
I was waiting you to ask, whenever there is fits, ask few questions in your history. One thing, okay, maybe I missed this, known to have any condition, maybe I missed this, maybe they don't want to tell you the condition. At that time, you can ask like any skin changes you see in the child.
Yeah.
Means any skin changes. If you would have asked about skin changes, I would have told that there are some white patches on his body. There are some white patches on his body, so he was evaluated for that, like that. Okay, you asked about the team.
Okay.
Sometimes, mother will not give you all the teams. So when when if you ask skin changes, I would have told white patches. Then you would have explored about dermatologist. Did he go to the skin doctor, and did he do any examination under any mirror for him, like this hood lamp?
Yeah.
This was the clue. My case was the tuberous sclerosis with autism. Okay, sometimes,
Okay.
and you asked about two elder. You asked about this, but did you ask about similar condition in the family?
Condition? No. No.
Oh, you did not ask. If you would have asked, this is very important. Similar condition in the family. This is very important in family history. Because
Okay.
I would have, this runs in families, but most of the cases will be
Yeah.
sporadic. I told
Mhm.
two children are normal. They are, and they are normal. So this was presented as a sporadic case. Even if you would have
For the
explored, you
kids.
wouldn't have got it. Okay.
Okay.
It was presented as a sporadic case, but still this white patch and follow up with a seizure, with developmental delay, wearing glass.
Mhm.
Okay, all these things you
Okay.
can ask. And what I want to tell you is, even if it is autism case, after asking all your questions, now let me share the whiteboard. See, even if it is autism case, your case is speech, right? After
Yeah.
finishing with the autism, you have to ask about
Mhm.
speech to the mother. Take entire history to the mother. Sometimes what happens, autism children who are under treatment, or they can respond few things to the mother compared to others. Very few. They
Okay.
are lagging behind, but you can get many things from the mother, like what he can do, what he cannot do, like this. So for the sake of the examiner knowing that we know the speech, how to evaluate, we should do the complete speech and language by history here from the mother. Okay.
Okay.
So first thing,
Okay.
what happened, you called the child, he did not responded to you. Okay. Then second thing, you tried again to call him, he did not respond to you. Then you can just continue 2 or 3 times. Can he tell me? I will just try to again call him to tell his full name or age. He's not at all responding. Then you will tell, I will take the help of the mother to see if he sees the mother. If he does eye to eye contact with the mother, I will ask the mother to call him. In the room itself, take the help of mother. You called him twice, he
Yeah.
did not respond to you. I will take the help of the mother to call him and see if he does eye to eye contact with the mother. They may say, no, he's not responding to the mother, he's not doing eye to eye contact. Okay. Then I will,
Okay.
he's playing in his car. I told you already. I will try to show him another toy to see that if he shows interest in the another toy. First step, you took the help of the mother. Second step, you are taking the help of the toy. Okay.
Sorry.
I will bring him another toy. No, he's not seeing at your toy and he's just rotating his wheel. Okay, now you got, so I would like to ask him, just tell for the examiner to know. I would like to ask him his age, his complete name, his age, sex, everything, but the child is not responding to me. So I would like to take history from the mother. Okay. Like this, but also I want to ask few things about about his behavior, also from the mother. Like this, you will take history about speech and also his behavior. Then if you want, start with behavior or start with speech, whatever. So behavior, how you will start, as you said, you covered most of the points very nicely in behavior. I will just repeat it for our revision. So you asked
Yeah.
about if he needs something, how does he points? That is, he takes the mother's hand. You can say that I will show him some picture on the wall and ask him to see. Will he see? Will he see my hand pointing, or will he see the wall, or will he does not see? Both seeing your hand and does not seeing will go with autism. Seeing on the wall will not go with autism. Okay.
Yeah.
Pointing picture away, this is one thing. And another, what you will observe for the flapping of the hands, you asked for the echolalia, if he is doing repeatedly. Okay. Repeated behaviors. For the rigid routine, you will ask the mother. Okay. Does he has rigid routine? And you asked about tantrums. After taking all this history about behavior, you will go for the speech. Now she's telling you that he speaks only 6 words.
So
From
far.
this, you got to know
Yeah.
that he's around 81 to 1.5 year maximum. Right. So you got about
Yeah.
your CV finish. Your CV finish. Your I don't know how is your format. Is it the same? You do CV scop?
Yes, yes, it's the same. Yes.
Okay. So your yes.
NSAAB, yes, that's CV.
Okay, your yes finish. Now for C, I will just you just ask the mother if he counts any numbers at homes. Just asking her, maybe he may say one
No.
out of these 6 words, maybe he may say one, we don't know. Just to complete your scheme, ask her, can he identify any color? She said he knows only one color, red color. Okay. Sometimes they may respond few times to the mother, so you can take history from mother. C finish. So you will ask about any commands. If you give, does he listen to you? Maybe she may say he's not listening always, but sometimes one order command he can do sometimes. Then what is the another object recognition? If you give, you are not, he is not cooperating with you, so you are asking everything to her. If you give him the book, can he show you the some pictures? Can he point to some pictures? If I ask him, show me, if you ask, show me the duck, can he point? No, doctor, he doesn't point. Or sometimes he's pointing like this. Sometimes he is pointing. Okay, stop. Then P, you will ask for parts of body. Anytime he's telling
Parts
you,
of the body.
He's showing me only nose sometimes. Okay, parts of body, P. Then what you have? Prepositions. Prepositions you will not ask because he's not doing this before. Can he show you? Can he ask if you show you ask him to show books? Can he show you? No, doctor, he's not showing. So you asked for plurals and this. Other things are all above one. If you want, you can just ask, does he knows in and on? No, he doesn't know. As a format, just to show that you're doing everything speech in him. Finish off with this and then go to your social questioning. I think we have to do this. If we don't do, just do the autism and leave, maybe they will not accept, right? Next, give me.
So you ready?
Yes, give me.
Okay. So you're talking to Mrs. Aisha, mother of Zainab. And then the mother has concern about his hearing. So you're going to assess him in his hearing and speech.
Okay. Aisha, mother of Zainab. Okay.
Zainab, yeah.
Have concerns about hearing.
Yes. So assessment in speech and language.
So assess his speech and language. Okay.
Oh, let me fix the time. Okay.
Okay. Good morning.
Good morning.
This is Dr. Noor, one of the children doctor in this hospital. Am I with Aisha, the mother of Zainab?
Yes, I'm Aisha.
Thank you for coming here and nice to meet you, Mrs. Aisha.
You're welcome. Thank you for having me here, Doctor.
Today I'm here to ask you a series of questions about development of your child and take some notes. Is that right time for you?
Yes, no problem. You can go ahead, Doctor.
Okay, before that, how can I address you, Mrs.
You
Aisha?
can call me Aisha, no problem.
Thank you so much. Okay, can you tell me what are your concerns about your daughter Zainab?
So I noticed that anytime we call her, she doesn't answer. She doesn't turn to our name. And I noticed this about 1 year ago. I don't know. I feel maybe it's probably gradual. Like sometimes she hears and sometimes she doesn't hear. So I didn't really notice it. But after before 1 year ago, I noticed that when I call her, if she's not turning to me, she doesn't hear me and she doesn't answer.
Okay, 1 year ago, she's not, but before 1 year, she was okay, she was responding to you?
Before 1 year, she was responding to me if it is loud. But if it is a little bit not loud, she doesn't respond. But I thought maybe because she's a child, she was just playing.
Okay, I want to ask you, do you think anything has caused this, like she's not hearing? Is it from the birth also before you checked that she was like that, or after few months she became like this?
Well, truthfully, I think I noticed it when she had the ear infection.
Ear infection. Can you tell me
Yes.
this ear infection, at what age it was?
Well, she was 2.5 years old, and then I noticed that she was having regular hair discharge. Actually, before that time, she's been having hair infection. She had it when she was 1 year. She had almost 6 times in a year. But the one she had at age 2.5 years was, it took maybe like 2 months before it goes.
Okay, it took a long time. So,
Yes.
any hearing tests done for her?
No, she was supposed to go for hearing test, but I was busy, so we didn't
She's
go.
not on any hearing aids.
No, she's not on any hearing aids.
Okay. Any investigations done?
No investigation done, but she was admitted and she was given some injection in her tubes.
Okay. Do you know the name of the injection?
I cannot remember, but I don't know. I'm not sure.
Okay. Injection was done. She was admitted. At what age she was admitted?
When she was 2.5 years old, around that time, before she clocked 3.
Okay. When she was 1 year, she had so many injections. She was so many episodes of ear infection. She was not admitted anytime.
No, she was not admitted because those ones were just mild. Maybe 1 week it will go, but this one took like almost a month.
Is she known to have any condition or illness?
No, she's not known to have anything.
Okay. Do you see any time she has achieved any skills and lost any skills?
No, she didn't lose any skills. Just the hearing. I feel. Apart from the hearing, I don't think she lost any skills.
Any weakness in any part of the body? Do you notice?
No weakness.
Any you told all me about hearing. Any problem in her vision?
No, she sees very fine. She
Mm.
doesn't have any problem with that.
During her when she was small baby, her hearing test screening was done. Means new.
Yes, at
Was
birth.
newborn. It
Yes, it was. Yes, it was. It was done and it was normal.
normal. Okay. Is she on any medications now?
No, she's not.
Okay. I will ask you a few questions about her development. Can she go upstairs and downstairs?
Yes, she goes alone. She goes 1 foot per step and she comes down same way.
Okay. She can do skipping?
No, she cannot skip.
But she can run fast.
Yes, she runs very fast.
Okay. If I give her cubes, how many tower cubes she can build?
She, she can build like between 10 to 12.
Okay, 10 to 12 cubes she can build. And she can she make a bridge?
Yes, she can make a bridge.
If I ask her to draw, she can draw a circle.
Yes, she draws a circle very well.
She can draw a square.
Yes, she can draw a square too.
Okay, I want to ask, is she dry by day and night?
Sometimes she's dry by night. She's actually dry by day, but sometimes she's still bedwet.
She can use the toilet alone.
6 minute finish.
She
Yes, she can use the toilet. Yes.
Okay. So can she share toys with other children and play?
Sometimes she does, and sometimes she just wants to play alone. But yes, she shares her toys.
Sometimes she plays with the children.
Yes.
Okay. Do you notice any behavioral changes in her? She's good with all children intermingling.
Yes, she's good, but I just feel that she's frustrated because when they call her and she doesn't hear, and the person comes in front of her, and she just gets angry. No, but apart from that, she's good.
Okay, can you tell me about your pregnancy? Any problems you had, like diabetes, hypertension, or any scans done?
No.
No. Give me
Pregnancy went very smooth.
about the birth of Zainab.
Yes, it was very smooth, no problem.
No problem. Her weight was normal and she cried immediately after birth.
Yes, cried immediately after birth and we were discharged.
No admissions after birth.
Yes, we were admitted for like 3-4 days because she became yellow.
Okay, yellow.
And it was very high.
Was the light given for her? Light?
Yes, the light was given and then our blood was changed.
Blood was also changed. Okay. Any fever at that time? After? No fever. Okay.
No
You
fever.
told me only one admission at the age of 2.5 years. Any time any bug infection of the brain?
No, there was nothing. They
Trauma?
did not tell me that.
Any
No,
trauma,
no, not true.
any
Not
surgeries for
true.
the ear?
Yes, something was placed in her hair when she was admitted.
Okay. Can you tell me about your family?
I'm an housewife, and my husband is a teacher.
Okay. Any similar condition in the family of hearing
No,
problems? No.
no, she's our
You have
first
other
child.
children and they are fine?
No, she's our only child.
Okay. So can you, how is this condition impacting you?
It's very, very frustrating because I'm just very worried and scared that my daughter will not hear. So I've been
I'm
worried and
sorry
I've
for
not
that.
been able to concentrate.
I'm sorry for that, and we'll be working on it. And you already told me that the child is also frustrated because she can't hear. Is she going to school?
Yes, she's going to school, but our teachers are complaining that when they call her, she doesn't understand. So yes, it's very bad, and it's making me just feel so bad.
Do you need any financial support?
I don't know right now, but maybe we might need in the future.
Okay. So anything you want to tell me about her, which I missed?
No, I don't know. I don't know. I'm just very frustrated, and I just want to ask you, will my daughter be able to hear?
Actually, I can understand your frustration. We will evaluate her, we will examine her, and then we will try to do the best for her. When once it is finished, I will come back to you and address you about it. Is that all right?
Oh, okay, it's all right. 10 minutes finished.
10 minutes finished. Okay, today I took history from Zainab. Sorry,
Mm-hmm.
today I took history from Aisha, the mother of
I see.
Zainab. Zainab is a 4 years old child. She presented with mother has complaints of hearing problem in her hearing problem. She doesn't answer to her when she calls. She notices this from the age of 2.5 years, but before that also the mother had to use a loud voice to call her.
Mm-hmm.
Apart from that, she has no behavioral problems, no regression, no weakness. And her gross motor and fine motor is appropriate for the age, as well as the social development is appropriate for her age. The significant past medical history is she was admitted at the age of 2.5 years for ear infection, and some injection was given for her in her blood tubes, which the mother doesn't know what it is. And also she had repeated infections in her ear during the age of 1 year. She's not diagnosed to have any conditions, and no investigations is done like hearing tests or hearing aids. She's not following up with any doctors. When she was child, she had jaundice. She had neonatal jaundice, which was treated with phototherapy and exchange transfusion.
Okay.
And for socially, the mother is worried about whether her child can hear or not, and child is also frustrated because the friends will call and she can't hear. She is going to school, but there are complaints from the school about her hearing, and they are at the moment they are not in need of financial support.
Okay. In your history, you forgot to mention about the surgery, the grommet
Yeah,
that
yeah,
was
yeah,
inserted,
surgery was done. Okay.
and
Grommet.
then which
Okay,
one
I
other
will
one?
proceed with examination.
Okay.
Just do one thing. Whenever we do any mistake, we will mark it and then we will give in the feedback. Now I will proceed with the examination. Okay, you will keep 8 minutes
Okay.
now. After
Eight
summarization,
minutes.
8 minutes for examination and summary, then 3 minutes for discussion. So keep 8 minutes now. So I will wash my hands and I will start examining Zainab. I will just see whether she, I will just observe what is she doing in the room.
Hmm.
And
She's playing with her toys and she's laughing.
Okay. I will see whether she is well looking, not in distress. I would like to check her weight, height, and head circumference and plot on the appropriate growth chart for age and sex.
Mhm.
I want to see any
All normal?
unusual features in her face. Any unusual features in her face.
No unusual features.
Then I want to see if she's having any hearing aids, any eyeglasses, or any other devices attached to her, and anything she has brought in the surroundings.
No hearing aids. She's not using glasses, and nothing on the surroundings.
Okay, now I will start examining her for hearing. I will call her Zainab, Zainab from behind. Is she responding to me?
No, she's not responding.
She is not responding. Okay, then I will I will go a bit near and call her again. Zainab, Zainab, and I will make my voice loud. Is she responding?
She turned to you when you made of your voice very loud.
Very loud. Okay, I will ask the mother only one question about are they using any two languages at home and any
And
problem.
what?
How many languages they are using at home?
No, there's just English.
English. Okay. Then I will ask about her from the near only with a loud voice. I will ask, what is your name?
My name is Zainab.
Okay. Can you tell me your full name?
I don't know, Zainab. Zainab. What's my dad is? Yeah, Zainab Ibrahim.
Okay. I will ask, are you a girl? Are you a boy or a girl?
I'm a girl.
Okay. So I will ask, how old are you, Zainab? You know that?
I am 4.
4. Okay. Can you tell me where do you live?
I don't know. She doesn't know where she lives.
Okay. Do you know do you know your birthday?
No, I don't know. She doesn't know.
Okay. Zainab, you're a good girl. Can you sing a song for me?
Baba, she can sing Black Ship.
Baba Black Sheep. She can sing.
Yeah.
Okay. I will ask her, can she sing the whole song or just little?
She can sing it almost to the end.
Okay. Then I will ask, can you tell me a story, Zainab?
No, she cannot really tell you a story. She's just laughing and smiling.
Okay, then I will ask her to count for me the numbers. Can she count? Can you count for me? 1, 2,
She's
3,
using both hands to count, and she's counting up to 8, 9.
8, 9. Okay. I will ask her to, I will show her I will show her the book and ask her what is this color, what is this color, like this different colors, how many colors she can identify and say.
She can identify 3 colors.
And also she can tell.
Yes.
Okay, I will ask her for, I will show her some pictures. What is this? I will show the picture of the duck and ask, I will show the picture of horse and ask, what is this? Can she recognize? And,
Yes, she can recognize. Yes.
and also she can say that this is a horse, this is a duck.
Yeah.
Okay, I will ask her to take, ask her to take the horse,
Mhm.
keep it on the table and give it to mommy. Can she follow this?
Yes, she can do everything well.
Okay, I will ask her, take the horse, keep it on the
Mhm.
table, then take the ball and give it to mommy. Can she do this?
Yes, she can.
She can do. Okay, then I will ask, name me the parts of your body. How many parts you know? Just name me. I will tell her. Can she name?
She can name 5 different parts of her body:
5.
eyes, nose, mouth, head, and teeth.
Okay, I will try to know her prepositions. So I will ask her, can you keep this cat on the table? She will do
Yes,
that.
she's
Okay,
putting it on the thing.
I will ask her, can you put this cat in the box?
She's putting it in the box.
Okay, I will draw 2 circles. I will draw 2 circles and ask her which one is big and which one is small. Can she do that? Can she understand that?
Yes, yes. She says, well, I don't know. She chooses the small one as the big one.
Okay, she chooses the small one as the big one. Okay. Then I will give her a spoon and a duck and tell her which one of this we don't use for eating.
She doesn't know.
She doesn't know. Okay. So, in order to complete my examination, how many times
Mhm.
in
6 minutes.
okay, in order to complete my examination, I want to do a complete ENT examination for this child, and also complete neurological examination for this child, and also I want to do the developmental assessment for her in all the other areas. So today
Okay.
I examined, just 1 minute, pause the time.
Okay, stop. Okay. Salma. Hello, Joe. Hello, Joe.
No, it's already
Hello, Joe.
red and
Okay, you can continue. My children were making noise. I'm sorry. Okay. So,
Okay. Okay.
so today I examined Zainab, who is 4 years
Uh-huh.
old, for her speech and language. On my examination, she is well looking, no unusual features, and she's not on any hearing aids. My positive findings are she can hear with a very loud voice only. She responded to me about her age, sex, but she was not able to tell me the address and the birthday. She can sing a song, but she was not able to tell story today. She is able to count up to 8, and she is able to identify uh, 3 colors and name them. And she can recognize objects in the book and name them. And she can follow 3 order commands. And also sometimes complex commands also she demonstrated. And she can identify 5 parts of the body with and name them. She is able to identify the prepositions, but she is not able to understand the comparatives.
Okay.
Okay, with these findings, I can give her the age in the speech and language as um, 3 to 3.5 years, because most of the actions she's doing 3 years and some of 4 years.
Okay.
3 to 3.5 years. And has
With
an
me,
accelerated speech delay.
yeah, just a little bit. I don't think she really has this speech delay, because it's just 2 out of 5 domains that she didn't really, the story, because story is at 4 years old. 4
Yeah,
years.
she did not do. That's why I'm giving 3 to 3.5 for her. You want me to give 3.5 to 4? She did not do story, but she can do complex commands. Receptive was good. Complex commands she
Yes.
can do. Receptive was good.
Only experience. Yes.
So I will give separate in expressive and receptive.
You will just explain that the receptive was good and the expressive was no, was it a receptive? Expressive.
No, she order commands. You told even complex command. I asked one complex command. You told she can do complex command. Did you get like
Yes, yes.
horse on the table? Keep the horse on the
No,
table.
our receptive was good. She has problem in expressive.
Okay, so I will give for her 3.5 to 4 years for receptive and 3 to 3.5 years for expressive.
Yes.
Because she can sing a song, but she cannot tell a story.
Yeah.
This is in the expressive. For the order commands, even complex commands, she was understanding. But she was not able to understand the opposites here, means the
Yes.
comparatives.
Opposite is actually 5 years.
Mm.
So we don't expect her to really know the opposites. Opposition is 5 years.
Okay.
And
No.
she's just 4 years chronologically.
So she has a problem in expressive than the receptive.
Yeah.
Okay, so I
So
can 3 to 3.5 years in expressive and 3.5 to 4 years in receptive.
okay, so what is the probable cause of this problem in this hearing?
Maybe her repeated ear infections from the age of 1 year, and also she had severe infection at the age of 2.5 years, for which she was given IV antibiotics in the blood tubes. This is one reason. The another reason is in the neonatal period she had jaundice, and kernicterus was there for her, maybe because it was a severe jaundice which needed phototherapy and exchange transfusion both.
Yeah. So the differential diagnosis could be the child had chronic suppurative otitis media. It could also be due to query kernicterus, or it could be due to gentamicin toxicity. You are assuming, we are going to assume that the injection the child receives is gentamicin.
Okay, assuming to be gentamicin.
Yeah.
But this kernicterus and gentamicin both will cause sensory neural hearing loss, right? And
Yes.
the CSOM is conductive hearing loss here. There is a component of both.
Both, yes. So unless we do an ENT examination, we cannot know, or audiometry.
Whether this is just conductive or whether this is just sensory.
Yes,
hearing.
mixed, yeah.
Okay.
So that's all.
So management we have to tell, right? Management I have to
Yes.
So this child management is here. I will involve the multidisciplinary team management. Okay, she needs on my examination it looks to be an isolated delay in the domain of speech and language, that too in expressive language. So I need to involve the ENT team for the evaluation of the child, and also for hearing tests and hearing aids if needed, and then speech and language therapist to increase her expressive, to teach her the exercises to increase her expressive language. And I want to involve the community pediatrician for coordination, and she needs educational healthcare plan because she has problem in hearing in the school, and evaluation that if she needs special support in the school.
Yeah, that's about
These
it.
are the only things. Otherwise, I did not get any significant history which needs neurologist or anything.
No,
We
we
can say
does.
neurologist because of the kernicterus. We can consider if it has affected, but her gross motor and fine motor is very normal. If
Yeah.
there was any CP or something, usually it will cause choriothetoid CP.
Or
So
yes, visual ganglia, yes.
you would have got some history and abnormal movement. So I think not much.
So the child does not have the connector. We are just assuming that
Yeah, we are
it
just
could be.
assuming it could be one of
Yeah,
the causes, but we are not sure.
sure. Yeah.
Okay. Okay, I will give you the next case now. Comparison. Opposites means telling hot, cold like this. It is 5 years.
Yeah.
But for the comparative means you are showing them this is big, this is small. By 4 years, they can understand. Like showing in a picture means you are showing a small boy and you are showing a tall boy and asking them. They can understand by 4 years. But telling by their mouth clearly, Like this is hot, this is cold, that is 5 years. Okay.
Oh, okay.
So it's
Okay.
okay. One thing she did not do, so we cannot say. Nearly we can put her 3.5 to 4 years in receptive
Mhm.
and 3 to 3.5 years in expressive, because she was able to
Mhm.
sing a song but not story.
Yeah.
And also counting, she is going up to 9. That is
Yeah.
also good. The counting up to 10 is 4 years, so she's going up to
Yeah.
9. So that is okay. Not very much delayed. Maybe she needs some support and she will be fine.
Yes. Mainly support. Just needed support.
Hmm. Okay, so your case now, I will give you the universal cue for this. Okay.
Okay.
Richard is a 5-year-old boy. Okay. Richard is a 5-year-old boy. Mother is concerned about his development. Please take focused history from Janelle, his mother, and do the gross motor examination for him.
Okay.
Okay, start.
Hello. Good afternoon.
Good afternoon.
I believe you are Mrs. Janet, Richard's mother.
Yes, doctor, this is me, Janelle.
Janelle. Okay. Thank you for coming, Janelle. How was your trip to the hospital?
Yes, doctor, it was good.
Okay. I'm here to talk to you about Richard. So can you tell me, you said you've been concerned about his development. Can you tell me more about what you mean by this?
Yes, doctor, I feel that Richard is slow from his birth. He's slow, but now I want to put him to the school. He's 5 years old. I have already started him the school from 6 months. I am not happy
Mhm.
because he's slow from his peers. So this is making me worried. I need some good treatment for Richard. That's why I came here.
Can you tell me what you mean by slow? Slow in what areas?
In all, doctor, he's slow in all. I mean,
Okay.
he's slow in walking, slow in talking, writing, reading, everything.
Okay. And you noticed this from the birth?
Yes, it is from the birth. Yes, slow.
Okay.
He's
Apart from,
slow. Yeah.
yes. Apart from his slow in all this, is there any other thing you've noticed that you're concerned about?
No, doctor. He, as you know, he's known case of Down syndrome. He was after birth. The doctors told me that there are some changes in his face, and they suspected that he has Down syndrome. Then they did some blood test, and they told that he has Down's syndrome. They
Oh,
confirmed it. This is maybe
uh,
this is the reason they are telling, but still I need some good support for him.
okay. Hopefully, we'll be able to get you that support. So, he was diagnosed at birth with Down syndrome.
Yes.
Was he admitted after that?
Yes, doctor. He had some greenish vomiting.
Mhm.
They said he had some obstruction in his bowel. They did some
Mhm.
emergency operation to him, and then he was fine, no problem.
Okay. So, can you tell me like how many days did they spend in the hospital, and apart from the surgery, did you receive any blood?
Yes, no blood was given. He is okay with the blood, but he was kept
Mhm.
in the hospital for 1 week for the improvement. He improved well, no problem. He was fine.
Okay. Apart from this greenish vomiting, was there any other investigations carried out on him?
At that time, yes, they did jelly scan of the heart, and they told that he had small hole in the heart, which closed by
Mhm.
itself, doctor.
Okay, excellent. Which doctors is he currently following up with?
Till the age of 3 years, he followed with the heart doctor, and it got closed, and they said no need to follow up. He's fine. Until
Okay,
1 year, he followed up with the tummy doctor for
okay.
this operation, and then nothing. We stopped following up because of the COVID-19. He had
Oh,
some follow-ups with some exercises as well, but from 1 year we are not following up with any one doctor. We stopped following
may I know why you stopped following?
because of this COVID-19, and there were some lockdown. We were not able to go, and even I was busy, so I could not.
Okay. Did he? Has he gone for his hearing tests?
Yes, it was done at birth only, and it was fine.
Okay, on the outboard. How about eye tests? Any eye test done?
Yes, when he was 1 year old, eye test was done. They told his eyes are okay, no issues in the eyes.
Okay, excellent. Okay, so was there any jelly scan done before during the pregnancy, anomaly scan?
Yes, they did, but they did not tell me anything about Down syndrome in the scan, doctor.
Okay. And during his pregnancy, you were not sick, no fever, no rashes?
No fever, no rashes.
Okay, excellent. Okay, so apart from during this after birth where he was admitted, any previous history of admission?
No admissions till now, because his heart is fine, and otherwise he's a happy child, growing well,
Excellent.
but he's growing slow.
Excellent. Do you have any concerns about his vision?
No, doctor, he's fine with the vision.
Okay. Can you tell me what can he write if I give him a pen? Can
Uh,
you draw a circle?
yes, he can draw a circle. Yes.
Excellent. How about a square?
No, he cannot draw a square.
Okay. So yeah, can he draw mommy?
6 minutes, 4 minutes left. Okay.
Okay.
He will draw, but he will just draw maybe like a circle and
Mhm.
dots in it. And there are some no tummy. He will not draw tummy. Circle and legs only he will draw.
Okay, circle and legs. Okay, excellent. Okay. Can you tell me like how many words does it say in a sentence?
He can say only 3 to 4 word sentences.
Okay, can he count 1 to 10?
No. He can count 1 to 6.
Okay, 1 to 6 only. Okay, if you told him to take something and put it on the table, can he do it?
Yes, he can do that.
Okay, and if you told him to take something, put it on the table, and then bring it back to you, can he do it?
Yes, he can do.
Okay. Is it dry by day?
Yes, he's dry by day. Yes.
Okay. How about at night?
No, he uses nappies at
Okay.
night.
Okay. Can he dress with does he dress with supervision?
Yeah, no, he can undress himself, but dressing needs supervision.
Okay. Dressing needs supervision. Okay. Can you tell me how his condition has impacted you?
Yes, doctor, I am very much worried. I am a teacher and I work in a school. I want to put him to the school so that I can go to my job easily. Now the teachers are facing problem in the school because he's very slow compared to peers. I am worried.
Oh, okay. He's going to a mainstream school.
Yeah, he's going for nursery mainstream. Yes.
Okay. Okay. Can you tell me at what age did you deliver Richard?
Hmm. I was 40 years old.
Oh, Okay, excellent. Do you have any other kids?
Yes, I have two kids, elder to
Uh,
Richard. They are fine.
okay. And then there's no family history of similar
No,
condition.
no.
Okay. So I'm just going to ask you some questions. Is he on any medication?
No, he is not on any medications.
Okay, so it's not on any medication. Okay, so how has this how has Richard's condition impacted you and his siblings?
As I told you, now I want to siblings, no problem. Even for Richard, he's a happy growing child, no problem. Only I am worried. I want him to be in mainstream school like other children, a competitive child. So I'm worried.
Do you have any support group that you join?
No, as I told you, from 1 year I stopped support group also.
Okay. Do you have any allowance you're receiving on Richard's behalf?
No, doctor. They just told me that he is Down syndrome. But if he goes to school and if he needs any special education needs, then they will see. But at the moment, no financial.
Okay. Okay, no problem. Okay, so let me just go through this. Sure. How many seconds, how many minutes left?
Only 15 seconds left. Did you ask about?
Okay.
Uh, okay, no problem. Go ahead. You can proceed. If you finish, summarize your case. No problem.
There's something I feel I'm missing and I cannot remember.
Thyroid, maybe thyroid. You want to ask?
Yeah, other autoimmune, yes.
Okay, ask, no problem. I will give
Okay.
15 seconds. Okay.
Oh my God.
Thyroid, celiac, anything you want to ask? Tummy pain, area.
Yes.
Okay. No
I
problem.
know that I'm missing autoimmune. This is no problem. That is gone. So today I took history from Janelle, the mother of Richard, who is a 5 years old boy. She's concerned about his development. She noticed he's slow from birth. Richard is a known Down syndrome diagnosed at birth. He's had surgery for intestinal obstruction. He's supposed to be following. He stopped. Supposed to be following a physiotherapist, occupational therapist. However, mother stopped going due to lockdown and COVID infection. He stopped. He stopped. He used to have. He used to go to the cardiologist and the gastroenterologist. However, he has been discharged. He had his hearing test at birth. He has not had a repeat for preschool. His eye test was normal. Um, what else? Is fine. He is fine. Mother does not have any concern regarding his vision. Um, he could not. He did not. He could. He can't draw a square. He has 3/4 words in speech. He's not dry by night. However, he's dry by day. He can undress himself with supervision. Is currently going to a mainstream preschool. The mother does not have any support group.
Okay. So you can start examining
So I'm
Richard.
going to wash my hands and then assess Richard. I can see that he has features of trisomy 21. Is he in any distress?
No.
Okay, I would like to take his height and weight and plot on an appropriate growth chart. So I'm going to
Okay.
take.
He's on second centile for weight and height.
Okay, second centile. Does he have any equipment in his surrounding?
No.
No equipment. So I would like to take my tools to play with Richard. So
Okay. What tools you'll take?
first I'm going to take a ball, and then I'm going to take what else? There's going to be a tricycle there, and then like a stairs.
Stair skipping rope. Okay.
Yes,
Okay.
skipping. Mhm.
Okay,
So I'm going to start with asking him to take the stairs. How is it taking the stairs with support?
means you want him to climb the stairs, you mean?
Yes, I want him to climb the stairs.
Okay, he is going up like adults, coming down
Mhm.
like a child.
Okay, excellent. Okay, I'm going to ask him to stand on one foot. For how many seconds is he standing?
Okay, standing on one foot, only 1 second he will stand.
Okay, 1 second, 1 foot. Okay, so can he ride a tricycle?
Yes, he can ride. He is very happy to ride.
Okay, so I'm going to distract him and then take the tricycle away. So
Okay.
so else, okay, I'm going to ask him to jump. Can he jump? Is he
Yes.
jumping to the
Yes.
front or to the back? He
As
can
you
jump.
say, what command you want to give him?
What did you say?
What command you want to give him? You want him to jump front or jump on place? What do you want
I
him?
want him to jump in place. Can he
Okay,
jump in place?
he can jump in place. Yes.
Okay, can he jump to the front?
Yes, he can jump front with 2 foot, not with 1 foot.
Okay, with 2 foot. Okay, so can he walk in tandem to the front?
No, difficult, doctor.
Okay,
No,
so
tandem.
not front. Okay, so now I'm going to give him the ball. Can he kick the ball while standing?
Yes, he can kick.
While running?
Difficult. He will fall down.
Okay, so I'm going to give him the ball, and then I'm going to ask him to throw the ball. How is he throwing the ball? Is it with outstretched hand or above his head?
Outstretched hand he throws.
Okay,
No,
outstretched
sorry.
hand.
Throws from above his head. No problem. But
Okay.
catching is outstretched hand.
Okay, yes, crouching, outstretched. So catching is outstretched hand, not to the chest and not above the head.
No. Catching to the outstretched hand, but he can throw from above the head. No problem. Throwing is easy for him. Catching is a problem for him. Okay.
Okay.
Okay. Then
Okay. Then what else? Ball, climb. I think that's all.
did you just ask for skipping for him?
Skipping? No,
Ask.
he cannot do it. Okay,
He
can he skip and can he hop?
No, he cannot do that. Okay.
Can he hop?
No, he cannot. Okay.
Okay.
So, okay, you're done. So
Yeah.
present your case if you have done, and tell in order to complete my examination before presenting what you want to do in this child in order to
In order to complete my examination, I would like to do a neurological examination of neurodevelopmental examination for Richard. I would like to do I would like to do an ENT examination also. I would also like to do what else?
ophthalmological examination.
Ophthalmological, but they said no visual concern, and
It's
it was
about
normal.
all the problems of the Downs, because
Down.
in fine motor also he is back, right? She's not following up. She's not following up,
Yes.
right? So tell all the problems of Downs, like neurology, you told ENT, you told ophthalmology, you told abdominal
And then
examination,
examination, yeah.
because they
Even
can
after being discharged from the abdominal examination from the gastroenterologist.
slow. They will develop. Maybe he will develop hepatosplenomegaly. They are prone for leukemias. They are prone for constipation. Lots of things. So just for the evaluation of Downs, and also complete developmental assessment. This is more important. You can put it in the top. Complete developmental assessment in all domains, because you did only gross motor here. History only you took about others, right? So
Yes.
complete developmental assessment in all domains, and
Okay.
want to also look for, otherwise you can say I also want to look for associations with Down syndrome. Features of
Okay. Yeah.
associations with Down syndrome, like thyroid, celiac, all these.
Yeah. Yeah.
Yeah, you can tell like like this features of association with. So I want to do the thyroid examination to look for any features of celiac disease, neurological examination, ENT, ophthalmology, abdominal examination, like this. Then you can present your case. Okay, tell the present your case.
So today I examined Richard, who is a 5 years old lovely boy, known Down syndrome, diagnosed at birth. I assessed his gross motor development. Um, he goes up. He can climb the stairs with 2 feet and comes down with 1 foot. 1 foot. He stands on one foot for 1 second. He can jump in place. He cannot walk in tandem to the forward. Um, he catches the ball with outstretched hand and it throws the ball from above his head. He can ride a tricycle. And what else? What else? So, putting all this together, I would like to give him a developmental age of let's see, 2.5 to 3 years.
Okay. Okay, developmental of it. So is this a global developmental delay or
Yes. I would like to do a full neurodevelopmental examination because from the history, is fine motor, speech, and social are also delayed.
so he's a case of global developmental delay
Global
with,
developmental delay. Yeah.
with you will give gross motor 2.5 to 3 years. Okay.
Yes.
No problem. It was good. So how do you manage this child? How do you want to manage this child?
Um, Management. I will start with investigation. I would like to do a full blood count and differentials to check if there's any blood diseases. I would also like to screen for autoimmune diseases, celiac and hypothyroidism, doing IgA and IgA-TTG, and also thyroid function test. I would like to involve my seniors and the multidisciplinary team, which is going to be headed by the community consultant community pediatrician, who is going to be the one in charge, and also is going to need a neurologist. Is going to need what else? Is going to need a ophthalmologist and then ENT specialist, speech and language therapist. Is also going to need physiotherapist, occupational therapist, and then education healthcare plan. And the mother is going to need social support also.
Oh,
What
okay.
else? Yeah, I think that's all.
Okay.
According to
What is the reason for delay in this child? What do you think is the reason for delay in this child?
the delay is most likely due to hypotonia, generalized hypotonia.
Apart from that, only one hypotonia.
And then apart
What
from
are
that,
the causes in Downs apart from hypotonia?
okay, I think I forgot. It could also be due to if it is associated with hypothyroidism, then this could also be one of the causes. And
Okay.
then
You
what
can
else?
tell like this. Yeah, three to four causes you can give in Downs. Any Downs baby in general. You can say that the syndromic nature of the Downs itself will cause them have learning disabilities and all these things, right? Down syndrome is I think it is the number one syndrome which causes
Yes.
Down's learning disability.
Yeah.
So you can say the Down syndrome itself, the Down syndrome or the syndromic nature, the Down syndrome itself has caused the delay in the child. This is one thing, and they present with hypotonia. Then they can have hypothyroidism. This is other thing. Any associated conditions like maybe the heart or they will cause, means the chronic diseases in them may cause the delay, right? Any chronic disease will cause delay in the child, right? So
Yeah,
in
yes.
general you can speak, maybe you have to evaluate. He's not following up from long time. Maybe he has developed any hypothyroidism, or he has low weight. If you see second centile, maybe he has developed celiac disease. We don't know. We just evaluated for development, but we did not evaluate for celiac. He has failure to thrive now. His weight and height is on second centile. So you can say one is the syndromic nature of Down syndrome itself causes learning disabilities, and it is associated with hypotonia. The syndrome learning disabilities, hypotonia. Hypotonia will cause gross motor problems, and learning disabilities in general, they are backward, and hypothyroidism and any associated conditions. Maybe he has celiac, maybe he has thyroid, we don't know. Okay. Or even the heart disease, if they have VSD, AVSD operated on any medications, all these things will cause delay. All right. So 4 things. Let's remember as 4 things. One is the Down syndrome. And,
and then the hypotonia,
which causes Down syndrome. Under Down syndrome, you'll get hypotonia and learning disability. Okay.
Yeah.
And associated associations, you can say hypothyroidism, or even and any chronic diseases like celiac disease, or heart problems, kidney problems, like this. Okay, kidney is less likely in them. We can say about heart.
Yeah.
Okay. Okay.
So apart from the autoimmune that I missed, is there any other thing I missed in the
Yeah, you should
history?
ask about constipation also with them. You know, Hirschsprung's is common, or constipation is common in them. And if there means 1 or 2 questions, you cannot go like history station here. So if you miss vaccination, it's okay, doesn't matter. If you miss allergy, it's okay, doesn't matter. 1 or 2 association questions you can ask here. One is the thyroid, any swelling in the neck, or is he following up for his thyroid, or any vomiting, diarrhea, constipation, all will cover for celiac disease. Okay, because he has less weight. Then Hirschsprung's will be in the child. She gave only for you about bilious vomiting. Maybe it was duodenal obstruction. So also you can ask about constipation during the early period of life. This is very important. Autoimmune is important, and heart is important. Apart from that, I will see. If I remember, I will message you. Okay.
Okay, no problem.
I think in neonatal guidelines, it's given very nicely. We have to go through again.
Down syndrome. Oh, okay.